Welcome to Medical Dialogues. I'm Anshika Mishra. Here's what I bring to you from the world of medicine. Long COVID and Myalgic Encephalomyelitis, or chronic fatigue syndrome, strongly interlinked. People suffering from long COVID or myalgic encephalomyelitis or the chronic fatigue syndrome could benefit from the coordinated treatment strategy a new University of Otago study has found. The pilot study, published in the Scientific Reports, a Nature journal, has confirmed what researchers have suspected for some time. The two conditions are closely related. Lead author Emeritus Professor Warren Tate says the research, the first comparative molecular study of the immune cell protein of both conditions, strongly affirms the link between the two. This means information from the study of the pathophysiology of the ME/CFS and the therapeutic opportunities that have slowly accumulated over the last 30 years can be transferred to understanding and treating the new estimated 100 million cases of long COVID worldwide. But equally important, the immense resources put into the long COVID research currently in the rich nations, while yet to produce major breakthroughs, can also benefit the many millions of hidden ME/CFS patients whose number have increased steadily over time in the absence of the recovery from the illness.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
A new way of looking at Parkinson's disease, says study. An international research team led by Kreml Brain Institute neurologist and senior scientist Dr. Anthony Lang has proposed a new model for classifying Parkinson's disease. In recent decades, researchers have uncovered several biological factors that underlie Parkinson's disease. Key factors include a buildup of the protein alpha-synuclein in the brain, which leads to neurodegeneration, and genetic factors that increase one's risk of developing the disease. They've also begun to develop reliable methods to test for these factors called biomarkers in these living patients. Despite these advancements, doctors still diagnose the disease based on clinical features, such as the presence of tremors and other common motor symptoms. In a recent article published in Lancet Neurology, Dr. Lang's team proposed a new, biologically based model for classifying Parkinson's disease called SynNeurology. According to Dr. Lang, who is the Lily Safra Chair in Movement Disorder at the University Health Network and the Jack Clark Chair for Parkinson's Disease Research and a professor in the Department of Medicine at the University of Toronto, this traditional approach to diagnosing Parkinson's disease does not account for the complex biological processes at play. 1 week FDG PET-CT predicts treatment response in advanced melanoma. Cancer immunotherapy has helped transform the standard of care for many malignancies, but not all patients respond to therapy and the treatment can cause severe events. Typically, immunotherapy patients are imaged around 3 months after starting treatment to monitor their progress. The research team, led by Michael D. Farwell, an associate professor of radiology at the Hospital of the University of Pennsylvania, hypothesized that by using F-fluorodeoxyglucose, that is the FDG, PET-CT, which is one of the most common and readily available ways to test for cancer, patients could experience metabolic changes in tumors after a week on immunotherapy. The study is published in Clinical Cancer Research, a journal of the American Association for Cancer Research. To test their hypothesis, the researchers recruited 21 patients with advanced melanoma scheduled to initiate pembrolizumab. As part of the trial, patients were required to have at least one measurable lesion and could not have received previous anti-PD-1 or anti-PD-L1 therapies. FDG or PET-CT imaging was performed on each patient within 4 weeks prior to the start of therapy and then at about 1 week after the first dose of pembrolizumab. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.